Okay, so in this video, I'm going to go through how to make a nice complete care plan, or excuse me, a concept map. And so I'm using this example that you have, that you see on your screen right now, where the nursing diagnosis is in the center. We're using a patient out of the Lewis text. The patient starts on 460, the case study of this patient, and it's got a patient introduction, and it says, FT is a 70-year-old Black man who comes into the emergency department with nausea, fatigue, and increased shortness of breath, which started 3 days ago. He states that he started using his albuterol inhaler every 4 hours 2 days ago, and while it worked initially, it's no longer helping. He can only walk a few feet in his apartment before he becomes short of breath. He sleeps in a recliner in the living room. He has noticed some swelling to his hands and feet, and he has been having trouble urinating. So instead of going over the discussion questions, we're going to read more information about our patient. In order to form a nursing diagnosis, we've got to do more of our assessment. Um, Go to page 464 in your Lewis textbook. That's the big red one. So on 464, there's subjective data. And remember that part of our assessment includes asking for a complete health history. So it says here, a focused subjective assessment of FT revealed the following information. He has a past medical history of COPD, hypertension, heart failure, benign prostatic hypertrophy or hyperplasia, and no history of allergies. And then it goes through a list of medications that the patient takes. We're going to continue on with this case study and look at page 467 in your Lewis textbook. And there it says physical examination findings of FT are as follows. Temperature 38 degrees Celsius, apical pulse 110 irregular, respiratory rate 30 regular, shallow, slightly labored, blood pressure 170/90, sitting on the edge of beds with arms resting on bedside table. Skin color normal for race with no signs of cyanosis. Using accessory muscles in neck and shoulders. Trachea midline, barrel-shaped chest, chest expansion minimal but equal. Prolonged expiration. Slight clubbing noted. Edema, 3+ pitting edema of bilateral lower extremities and feet. Lungs have adequate air entry at apices, bilaterally with fine crackles, decreased air entry to the right middle lobe, and both bases with coarse crackles. Slight expiratory wheeze heard throughout all lung fields. The patient has a cough that is moist, productive, with yellow-tinged sputum. So you decide to check his pulse ox, and it's 87% on room air. Let's look at page 475. There's the objective data, including the diagnostic studies for our patient. So the healthcare provider orders the following diagnostic studies, and the results show that the SpO2 is 87% on O2 at 3 liters via nasal cannula. The chest X-ray shows a slightly enlarged heart with bilateral consolidation to both lower lobes. Right there, what I'm going to recognize is that this patient has a history of COPD and heart failure. The patient is swollen on their extremities, bilateral low extremities, 3+ pitting. So I know that they're having a heart failure exacerbation. And then I see that the patient has bilateral consolidation to both lower lobes, and that indicates this patient probably has pneumonia. So because I include that with the temperature of 38 degrees, I believe, Celsius. And then if we continue to read through, this shows information from the EKG, but then also the WBCs are 17,350. Okay. It also shows the potassium is 2.9. So that's the end of the information that we're provided for FT, our patient. So we're going to look at this concept map, and the first thing we have to do is figure out our nursing diagnosis. The way that you use your nursing diagnosis handbook, your ACLY book, is to take the medical diagnoses that the patient has and use the pages at the front of the book that have green edges and look up your medical diagnosis based on alphabetizing based on the alphabet, right? So COPD, I'm going to look it up in the C section. And as I flip through the pages, I find that COPD is located on page 42. I'm going to read through the nursing diagnoses available there. I know that this care plan that I'm doing today, or excuse me, this concept map that I'm doing today, I've got to pick up the priority diagnosis for the middle of this concept map. And so I look through the COPD nursing diagnoses, and then I'm going to look under heart failure because this patient also has heart failure. And they are swollen, so I'm thinking they have a heart failure exacerbation. Shortness of breath, swollen. And I see that heart failure is located on page 59 of the green pages in my Ackley book. And I read through the nursing diagnoses there. Then I go, well, I think this patient has pneumonia. The doctor hasn't said it yet, but I think they kind of do based on the x-ray and the WBCs. And so I'm going to look for the pneumonia diagnosis in the green pages, and I find that it's on page 94. And I'm going to read all the nursing diagnoses related to those 3 medical diagnoses. Of the diagnoses available, there are some that overlap with all 3, obviously, because we've got respiratory issues for all 3 medical diagnoses. The one that I want you to do this concept map for is the nursing diagnosis of impaired gas exchange, okay? Okay, so our nursing diagnoses make up the bulk of our Ackley book, and so they're behind those green pages. There's ones, white pages, that have like little purple tabs, and it's also alphabetized. But if you go to I, the letter I, on the little purple tab, and you try to find, right there it is, and you try to find impaired gas exchange, you're not going to find it in the eyes. You're going to find it somewhere else. And so if for me to find where else I might find it when it's not where I think it is, I'm going to use the index at the very back of the book. Everybody knows how to use an index, right? So when I look for impaired gas exchange in the index, what I find is I believe it's actually on page 420. So yeah, the index tells me it's on page 420. So you're going to use your green pages, your index, and then your white pages with the purple tabs to find your nursing diagnosis in the book. Now that I'm happily within my nursing diagnosis section in my nursing diagnosis handbook or textbook, I'm going to look at the definition of impaired gas exchange, and I see here that it's an excess or deficit in oxygenation and/or carbon dioxide elimination at the alveolar capillary membrane. So what I'm going to do is I'm going to read my defining characteristics. And the defining characteristics are the signs or symptoms that you're going to use when you're writing your nursing diagnosis. Remember in the pre-lecture I talked about nursing diagnoses should be written in the PES format. That's the problem, which is the nursing diagnosis of impaired gas exchange. The etiology, which is kind of like what caused that problem, and then the signs or symptoms, how we know that the patient has this problem. So I'm going to do impaired gas exchange, and then the etiology, I'm going to say would be changes at the alveolar capillary membrane. And then the symptoms are very many. We have a whole lot of symptoms that support this diagnosis. So I'm going to look back through the case study pages in my Lewis textbook, and I'm going to get the signs and symptoms that I believe best support this nursing diagnosis and show an impaired gas exchange. And then I'm going to get that nursing diagnosis box filled in, and I will be right back. Okay, so there we go. I have my impaired gas exchange related to alveolar capillary membrane changes. Oops, that should say changes. As evidenced by a pulse ox of 87% on O2 at 3 liters by nasal cannula. And that information comes from page 475 in the Lewis textbook. As I start to fill out the rest of the concept map, I'm going to start with signs and symptoms. And we have a whole bunch of signs and symptoms, right? Let's go back to our original page on 460, and we can start documenting the signs and symptoms this patient has. So I'm going to say this patient is fatigued. Fatigue. It shows that he's increased shortness of breath. It shows he can only walk a few feet in his apartment before becoming short of breath. So we'll let that fall under increased shortness of breath. And then it says he sleeps in a recliner. And maybe that's not signs and symptoms, but I'm gonna let it in. Swelling in hands and feet. I'm going to go then to page 464 with the subjective data. And there's really nothing there that I want to use to add for signs and symptoms. So now I'm going to look at page 467. And so here, because I'm doing the impaired gas exchange and not the pneumonia, I'm not going to use the temperature change as a problem, okay? Or as a sign or symptom. But I'm going to use the respiratory rate of 30. And I'm going to state that the respirations are, I lost it, I'm sorry, shallow and slightly labored. You remember when it said that you went in the room and the patient was sitting on the side of the bed with the arms on the tray table or something like that, the bedside table. And so if we remember, that's called orthopnea. If you don't remember, go ahead and watch the supplemental video that's posted on Blackboard. It says no signs of cyanosis, normal color skin, barrel-shaped chest expansion minimal but equal. Let's see. I'm just looking for things that have to do with the alveolar capillary membrane, things that show that that there are changes in the alveolar capillary membrane. So I think we have the crackles there. I think crackles are important. And then a slight expiratory wheeze, because it's overall Longfield's. And then I think that's it that I'm going to put in signs and symptoms. You notice that I addressed only the issue at hand. I didn't write down every respiratory issue, but just the ones at hand. Okay. Okay, so for the etiology and pathophysiology box, I'm going to choose to look up the different disease processes that we identified in my Lewis textbook. That's how you're going to fill out the etiology and pathophysiology, is by using your Lewis textbook. And so when I looked them up, I decided that the correct pathophysiology to use would be the one for pneumonia. If you use your index in the back of your book to look for pneumonia, you'll find on page 505 of your Lewis textbook the pathophysiology for pneumonia. And it actually has a really cool graphic there on the top right-hand side of the page, figure 27.1. And then when you read the two paragraphs related to pathophysiology of pneumonia, the second paragraph says, talks about atelectasis and consolidation. If you remember, our X-ray showed consolidation for patient FT. So it says, on the other hand, consolidation, a feature typical of bacterial pneumonia, occurs when normally air-filled alveoli become filled with water, fluid, and or debris. This can potentially obstruct airflow, impair gas exchange, and cause the signs and symptoms associated with bacterial infection. So now I believe that I'm on the right path. And when I look at the little picture, the figure 27.1, it shows that there's an inflammatory response to the bacteria in the lungs, and that causes the alveoli to fill with fluid and debris, and that causes decreased gas exchange. So go ahead and look at the figure if you haven't yet, but I'm going to go ahead and get my box filled out. Okay, so I put the etiology and pathophysiology in my own words, and I stated that bacteria in the patient's lungs cause an inflammatory response, and the inflammatory response causes the alveoli of the lungs to fill with fluid and debris, and this causes decreased gas exchange. You want this to be simple enough that you can understand it, or maybe even use it to explain to the patient what's going on. The next box that we have is the box with labs and diagnostics. So that's on page 475 in the case study green box. And so basically we can document everything here. And I'm going to start with some little dashes or bullets. And so here I can include the chest x-ray shows slightly enlarged heart and bilateral. I'll probably pause and get this filled in. Okay, so you see there, I included the chest x-ray that showed a slightly enlarged heart with bilateral consolidation of both lower lobes, the ABG that showed compensated respiratory alkalosis with hypoxemia, the WBCs of 17,350, and then that the sputum results are still pending because those are related to that impaired gas exchange that's related to the pneumonia, the bacterial pneumonia that the patient is suffering, most likely. Of course, we're going to wait for sputum results and things like that. But this is the direction that we're headed. The next thing we've got to look at would be our SMART goals. So we're going to develop 3 SMART goals. Okay, so to develop 3 SMART goals, we're going to look in our text, our Ackley book on page 421, and it has client outcomes. Remember that SMART goals are outcomes. So it says that the client will, and then in parentheses, your book says specify time frame, right? Let's see, and there we go. Client will specify time frame. And then there are 3 bullets. It says demonstrate improved ventilation and adequate oxygenation as evidenced by blood gas levels within normal parameters for that client. The second one is maintain clear lung fields and remain free from signs of respiratory distress. And the third one says verbalize understanding of oxygen supplementation and other therapeutic interventions. So there are 3 client outcomes in the book, but we can come up with our own client outcomes. We do not have to use the ones in the book, but they definitely give you a good place to start. And if you pick the ones from the book, it's really going to be hard for your clinical instructor to, say that maybe you didn't pick good SMART goals or client outcomes. So I'm going to go ahead and I'm going to pause the video again, and I'm going to work on writing 3 SMART goals for this patient. Make sure they're patient specific and that they're achievable and measurable. Make sure they're SMART. But I'm going to pause the video and do that, and I want you to go ahead and write some of your own. You can go ahead and pause the video too and write 3 of your own SMART goals. Okay, so let's look at my SMART goals. I chose the patient will demonstrate improved ventilation and adequate oxygenation as evidenced by blood pH between 7.35 and 7.45, PaCO2 between 35 and 45, and HCO3 between 22 and 26 by the end of my shift. Number 2, the patient will have a respiratory rate less than 26 by the end of my shift. Is that my end goal? Do I just hope that the patient only ever, gets to a respiratory rate less than 26? No, I want them to have, a quote unquote normal respiratory rate. But first off, I've got to be patient specific and I have to be achievable with my SMART goals. So this patient may not ever get to the point where they don't have a respiratory rate that's increased at least a little bit. And also, in one shift, it may not be achievable to get between, a respiratory rate between 12 and 20. So I chose something, kind of in between there. It's improved, but it's not, you know, ready to go home improved because I don't think I can fix this patient entirely during my shift. And then number 3, I have the patient will have 0 expiratory wheeze by the end of my shift. Is that achievable? I don't know. I would have to look back maybe at old records or talk to the patient or maybe their doctor about whether or not, 0 expiratory wheeze is possible. But I chose it as a goal. And you'll notice that I can measure all 3 of my goals, that they're patient specific. I aimed for achievability and that I did make them time sensitive. So next we're going to document the medications and treatments. And this isn't going to be complete and accurate because I've got the patient is just now being admitted. But I'm going to document the medications and treatments that are happening currently. So I want you to go ahead and do that too. Look in your book and get the medications and treatments documented on your concept map. Okay, so there are the medications, and I really don't have any other treatments to document, but those medications came from page 464 in the textbook. Treatments that I would expect that the doctor would put for the patient might be some different respiratory medications. Of course, I think the doctor's going to start some antibiotics to treat the infection in the lungs. I'm also going to expect that we're going to, turn, cough, deep breathe, and that we'll probably have an incentive spirometer ordered. I imagine that he's going to order respiratory therapy to see the patient and maybe get a PT/OT consult to come see what they can do for the patient. I do want you to know back on those SMART goals box, the patient can't walk 100 feet without getting winded. And so that would be another great SMART goal would be, to state, how many feet the patient might walk without getting winded. And I think, for my shift, I can't expect them to walk 100 feet without getting winded, but could designate another number that seems achievable. So the next box that we're looking at would be the nursing interventions. And I want you to think about this. For my SMART goals, I mentioned things that I'd mentioned in the signs and symptoms. Signs and symptoms are also called problem, right? Problem. The patient comes in with their problems, and here are the problems that are associated with this nursing diagnosis, or the problem that the nurse has identified that this patient has impaired gas exchange. And so then you'll see everything is kind of going together. The signs and symptoms, the SMART goals. Well, my nursing interventions must address the SMART goals, which address the signs and symptoms. It should all be tied throughout. So as I come up with nursing interventions, I can use my Ackley textbook. It gives a ton of options for interventions. And I'm going to pick interventions that are aimed at my SMART goals and signs and symptoms. And I'm going to pick interventions that I am actually going to do for my patient. Okay, so I'll pause. You go ahead and pick 3 nursing interventions for this patient as well. Okay, so I chose to, number 1, administer ordered medication, and then I would list them out, the ones that are going to affect this particular problem. To help rid the alveoli of fluid and debris so gas exchange will improve. Notice how I included the intervention plus the rationale. I included the rationale. Number 2, help the client deep breathe and perform controlled coughing to clear any secretions in the airway. And that should help with, sorry, I'm changing my little things here. So that should help improve the oxygenation. And then the third thing I chose was to recheck the ABG 30 to 60 minutes after initiating treatment plan or changing O2 administration to see if the treatment plan is effective. So you'll notice I chose interventions from the Ackley book and I included a rationale. So that's important to do. So the evaluation here, I just made some up because in our case study in our book, it doesn't give us any information about how the patient's doing after admission. But number one, I said goal not met as ABG showed PaCO2 was 34 and pH was 7.42 at the end of my shift. Number two, goal met as patient's respiratory rate was 24 at the end of my shift. And number three, goal met as patient had 0 expiratory wheeze at the end of my shift. So you see I performed the measurable part of my SMART goal and documented how the patient did with my SMART goals. Next, we'll do patient education. Okay, so please notice that for patient education, there are client, family, teaching, and discharge planning ideas in your ACLE textbook. And so I chose patient education that addressed the SMART goals and the patient problems. So I chose number one, teach the patient about the purpose and side effects of any new medications. And then I would list out the medications. If there's a whole bunch, maybe I'm just going to teach them about the purpose and side effects of 1 or 2 of the new medications during my shift. Number two, I'm going to teach the patient 2 energy conservation techniques during my shift. And number three, I'm going to teach the patient 2 relaxation techniques to decrease dyspnea and anxiety during my shift. What I want you to see is that patient education, it should almost always include educating about medications, almost always. And then also, it should look similar to your SMART goals. They should be reasonable, they should be achievable, they should be patient specific. And I want you to think about the time frame that you're doing it during your shift. That way you choose appropriate topics and appropriate amounts of information to teach during that time. So this is a completed concept map, and you'll see it's a nice visual representation of a nursing care plan. So in my next video, I will perform a nursing care plan about a different nursing diagnosis. Thanks so much. Bye.